All right, you guys can view the words, so I'm not going to read them to you. I'm going to try to take a page from Wes and make this short. Here's your learning objectives for this chapter. Look them over, make sure you can speak to them in your own words. Okay, skeletal. Your long bones, especially, like the long bones in the sternum, they create your platelets and your blood cells, and they're a place for attachments such as your ligaments and muscles. So anytime your skeletal system doesn't work well, nothing else works very well either. They provide storage for areas for mineral and fats. I feel like that's good. And you have all these different types of bones. We're not going to be questioning you on here's a bone, what is it? Because that was anatomy and physiology. Did I skip one? Nope, I sure did not. I want you to definitely know the definitions of all of these terms. I told you that when we were in lab. So you need to definitely know these terms and be able to know what that movement looks like. So abduction is to take away from the body, move away. Adduction is to add it back. Circumduction, are you able to rotate your joints in a circle? Internal rotation is moving the arms and legs into the body, and external rotation is moving away from the body. The rest of them, I feel like you can look up. You should know them. There's the video we did in lab that should explain it as well. Oh, look, it's here. All of those, so look them up. All right, and then these are the types of joints you have in your body. You studied all those in anatomy and physiology. The two that I want you to know are ball and socket and hinge. So ball and socket is shoulder and hips, and your hinge joints are elbow, wrists, and knees, and ankles. You have three types of muscle. That's all I'm going to say about that. Let's see. These are all of the functions of muscle, which attaches to bone. They're responsible for your ability to move, maintain posture, support the body, and obviously there's heat production when you are using muscle. Let me go back to see if I have any notes on that. All right, so the nervous system and muscle contractions. In your 50s and until the end of your life, you're going to have loss of fast twitch muscle fibers, which is going to delay nerve conduction. So just know that's part of why we slow down. The peripheral nervous system is responsible for carrying those motor and sensory messages from the CNS. It not only helps to move the muscles, but it also is responsible for sensory information. So those are both affected as you age. I'm looking at this to see if there's anything about this. Look at the chapter for this particular PowerPoint for the definitions of the different postural reflexes. All right, factors influencing mobility. You definitely want to be doing your complete health assessment of your patients when they are coming in. You need to understand where they are developmentally, what age range do they fall into, and know what their considerations are or their risk factors according to that. And then what's their physical health like? Sorry, excuse me. Knowing and remembering that any system that has an issue affects all the other systems. If they have mental health issues, know that if they're not moving, I mean, if they have depression, if they have anxiety, if they have other mental health conditions, they tend to withdraw and they don't move around as much. So get some information from them on how active are they and how much are they taking care of their mental health. If they have a mental health issue, is it affecting their mobility? What is their lifestyle? Are they sedentary? Are they active? Do they have attitudes and values that are causing them to not have the will to do the activities that they need to do? Do they have fatigue and stress or pain? What other external factors could be affecting them? Whether it's posture, movement, daily activity levels, acute chronic illnesses, poor nourishment, vitamin deficiencies. Just know we need to assess all of that. And then remember how I said every single thing is affected if you have immobility issues. It absolutely is. I'm pausing because I got to look at my notes. Right, I'm back. So if you're not moving, cardiovascular system, you're going to have venous stasis, which means the blood is just sitting there and not moving how it should be. You will have muscle wasting. Respiratory system is going to, you're not working those muscles, so you're not going to be taking deep breaths. You're not increasing your lung function. You'll have bone loss. Metabolic processes are also impacted. Constipation is a real thing. Cognitive decline, it happens because your brain atrophies when you're not using it and you're just laying around. Urinary stasis happens. So if the urine is just sitting in the bladder and it's not emptying, you have more of a risk for urinary issues. Skin issues, we've talked about the issues with people's skin, especially if they are malnourished and they're immobile. You can develop kidney stones, and I want you to understand this pretty plainly. If you're laying in bed, your bones are leaching out calcium. That calcium goes into the bloodstream. It also causes kidney stones. So we don't want kidney stones, and we don't want excess calcium in the bloodstream. You also want to look at their psychosocial lifestyle, because if they have psychosocial issues and they're loners and just staying in their house, they will have effects on their mobility as well. Exercise. Well, I tried to click on it. Exercise. I don't care if you know the different types of exercise, just know we want them to exercise. We want to know how much they're getting. We want to ask them about that. And we want to, let me just talk about really briefly. Do I want to go here? Yeah. Know that the benefits of exercise, people have a heart attack, they think, oh, I can't exercise anymore, I can't move because it'll strain my heart. Not true. That is, you want to be under the care of a doctor or other, nurse practitioner, whatever you're seeing, to assist you in safely exercising. But the more you exercise, the stronger those muscles get. The heart is a muscle. So you can help remodel that heart and improve the strength of the heart through getting cardiovascular exercise. You start out slow, and that's why we have cardiac rehab. We do strengthening to get our heart stronger. And these are your benefits. All right, come on. My mouse does not want to work today, guys. And then here's the benefits on metabolic and the GI system when you're exercising musculoskeletal. Risks associated with exercise. So if you injure yourself, then you could have a risk for mobility, I guess is what this is saying. So maybe contact sports or overdoing it when you should have started out slowly can lead to disability and other health issues. So your physical assessment for mobility, are they able to move easily? How's their balance? Are they able to stand up straight, or are they all hunched over? Do their eyes look forward when they're standing, or are they looking at the floor because they're bent over? Remember, we talked about kyphosis and how the spine gets hunched over when you have osteoporosis. So how's their alignment? Joint structure and function. Let's check their range of motion and make sure that all those joints are working. How's their muscle tone? How strong are they? And how much endurance do they have? And I want you to know, and I don't know if this is where I want to mention this or not, but instead of saying for your nursing diagnosis, risk for falls, don't pick risk for falls. The real problem is their impaired physical mobility. If they have impaired physical mobility, pick that because it's an actual nursing diagnosis. And if you fix that, then you're probably going to fix their risk for falls. We already talked about that. I don't know why it's in here twice. And we want them to exercise. This slide, I just want to tell you, save your back. Use your lift equipment. Workers' comp claims get denied a lot when people hurt their back at work because they come in and look at what lift equipment was available to you, and if it's sitting there covered in dust, they deny it because we should be using the equipment available to us. It gets used all the time in the long-term care and the acute care settings that we're going to see in Block 1. We need to use it in the hospital settings as well. If you are lifting something, make sure you're keeping your back straight. You're not twisting from side to side. Use your legs and bend your knees. Keep whatever you're lifting close to the body. Use your gait belts. Use your bariatric lifts. Use the power lifts. Look at figure 16 in the chapter. Also, if you have a patient who has a spinal injury or otherwise has an osteo issue, you want to move them as one. So you're moving legs and arms together to protect their spine. That's called log rolling. So get someone to help you. And if you're not sure if you can move the patient by yourself, don't second guess yourself because it takes one wrong move to end your career. Here you go. I guess I talked about that before I switched to that slide. All of those things can lead to back injuries for yourself. So make sure that you understand the mechanics and the ergonomics of an appropriate lifting and shifting and schlepping. Use your slides. Use your raise the height of the bed every time. Work at your waist level, a good working level, not down near the floor because you're going to be bending over too much. Standing for long periods of time also can lead to back injuries. So make sure you're taking care of yourself because if you're not, it's hard to have a long career. Do I have anything to say about that? Use your assistive devices. Have your patients use assistive devices. So after you have assessed them, I want you to make sure that if they need a cane, you know how to use the cane and you're able to assist your patient to safely use their cane, that you know how to use the walker and you can safely show them how to use their walker. Use gait belts. They are in every single room, I feel like, but they're in a drawer and nobody takes them out. We should be using gait belts for all of our patients who are fall risks. These are just all different things you can use. Look at this. See how this person's lifting? This is the correct way to lift. Back is straight. They're using their leg muscles and their knees, and they're straight on. They have it close to the body so that the center of gravity is is there and working with them. If you bend over like this, you're using your back, not your legs. You just need to make one wrong move and you pop something back here and you're done. If you need to position your patients because they have musculoskeletal issues or orthopedic issues, then you can use all these different things. Pillows, mattresses, you can get specialty mattresses. You can adjust the head of the bed, the foot of the bed. Use side rails if you need to. Remember, they don't use them in long-term care, but we use them in acute and we use them in the hospital. 2 is standard, the top 2. Sometimes we'll use 3, never 4. That's a restraint. Trapeze bar is just what it sounds like. It's a triangular shaped bar that is installed into the ceiling for patients that are able to move themselves by grabbing that bar and pulling themselves up. And, you know, there's other equipment out there too. Know your different positions of the bed. If you don't know them, you'll easily miss questions on an exam. These are the different mechanical aids for walking. We talked about that briefly. I think that we've gone over it in lab, how to use crutches and canes and walkers, but make sure you know exactly how they should be aligned and know which side of the body the cane goes on. See how her wrists are pretty much at the top of her hips, kind of at the waist level. That is how they should be right here. If it's down here, they're hunched over. And then which side does the cane go on? If you don't know, look it up. I'm not going to go over the different types of exercises. So I guess, you know what? That concludes our chapter in 17 minutes.